Hello everyone, we did our PowerPoint on the theorist Dorothy Johnson, who came up with the behavior system model. She is not only a theorist, but she is an educator as well as an author. Dorothy Johnson was born on August 21st in 1919 in Savannah, Georgia. Her dad was a superintendent of a shrimp and oyster company, while her mom stayed at home and was very involved. She is the youngest of 7 children. She went on to pursue a nursing career at Armstrong Junior College in Savannah, Georgia in 1938. She then obtained her BSN degree from Vanderbilt University in Nashville, Tennessee in 1942. The background of this slide is actually her graduating with her class in 1942. She then furthered her education and earned her MPH degree at Harvard University in Cambridge, Massachusetts in 1948. She completed her doctoral studies at UCLA, where she obtained a Doctor of Science in Nursing in 1951. Dorothy Johnson was a staff nurse at Chatham Savannah Health Council Hospital from 1943 to 1944. From 1944 to 1949, she was an instructor and assistant professor in pediatric nursing at Vanderbilt University School of Nursing. In 1949, she was a nursing professor at the University of California, Los Angeles until 1978. This is where she spent most of her career. In 1955 and 1956, she was allowed to go on a sabbatical, where she was a pediatric nursing advisor assigned to Christian Medical College School of Nursing in Vellore, South India. She also served as a chairperson on the California Nurses Association Committee from 1965 to 1967. She finally retired at 1977, where she moved to Florida until her death in 1999 at the age of 80. Dorothy Johnson's experiences at a very early age shaped her theory development. After obtaining her associate's degree, Johnson took a year off due to the Great Depression and became a teacher for 2 children, where she found her passion for children, nursing, and education. She believed that nursing is a unique science that involves discipline. Her goal was to conceptualize nursing for education of nurses at all levels, which she did do at her sabbatical in Vellore, South India. Johnson's publications include 4 books, more than 30 articles in periodicals, and many papers, reports, proceedings, and monographs. She had a very successful career. Dorothy Johnson's philosophical underpinnings of her theory was influenced by many theorists. Her model was greatly influenced by Florence Nightingale's book, Notes on Nursing. It advocates fostering efficient and effective behavioral functioning in the patient to prevent illnesses and stresses the importance of research-based knowledge about the effect of nursing care on patients. Her theory was also derived from other theorists such as Grinker's theory of human behavior and Buckley and Chin's theory of systems.
Johnson's theory defines health as an adaptive response to both internal and external stimuli within a patient's life while they are experiencing an illness of some kind. These responses are needed to maintain stability and comfort within the patient's life. The main goal of nursing within this theory is to foster equilibrium for each individual patient. This theory has 3 main focuses: human needs, the human as a behavioral system, and relieving stress from patients as a nurse. The 3 functional requirements of the model that are necessary to achieve these focuses are 1. To be protected from noxious or harmful influences with which the person cannot cope, 2. To be nurtured through the input of supplies from the environment, and 3. To be stimulated to enhance growth and prevent stagnation. Johnson's theory includes both stated and derived assumptions. It includes 4 assumptions about a patient's behavioral subsystems. These include a human's drive is the center point around their behavior to achieve a specific goal, meaning the patient's participation in their care is necessary to achieve the goals. 2, behavior is differentiated and organized in a human's choice. 3, the different parts of a human's behavior are created by their scope of the goal, their choice, and their actions. And 4, interactive and interdependent systems of human decision maintain homeostasis by using control and regulatory mechanisms. Johnson derived her concepts for her model from several different disciplines. These disciplines were modeled and refined by her to be used specifically in nursing scenarios and to be directly applied to her theory. The first concept is behavioral system. This describes that humans are a system, and that system indicates its state through their behaviors. Next is boundaries. This differentiates the inside of their system versus the outside. Then we have function, the purpose or consequences of a person's actions. After that is homeostasis. This describes how to maintain stability within a patient's life or health. Next is instability. This describes how the system wastes energy that is needed to maintain stability. Stability is described as the state of maintaining balance of behavior within a patient's life or health. A stressor is a stimulus, either internal or external, that results in stress on the patient. Structure is described as the different parts of a human system that make it complete or whole. A system is a whole created by independent parts. A subsystem is a smaller system maintained aside from the main system when the environment is not disturbed. And lastly is tension. Adjustment to change, demands, or disruptions, followed by variables, which are variables outside the system that influence behavior, which it needs to create the change to resolve the tension. Johnson had 7 subsystems to which the model applied. These 7 subsystems were also the relationships to which her model created. They were attachment, dependency, ingestive, eliminative, sexual, aggressive, and achievement. Attachment can be described as the need for security, which is created by either sociability or intimacy within a person's life. Dependency is the behaviors for attention, recognition, and assistance from others. Ingestive is what fulfills the needs for requirements like food or water. Eliminative function is necessary to get rid of waste. Sexual is described as the requirement for procreation and reproduction. Aggressive is self and social protection for a person. And achievement is the act of achieving self-control and control of the environment. Dorothy Johnson's model had 4 meta-paradigms: person, environment, health, and nursing. Person is the patient that is receiving the care. Environment is the internal and external factors related to the patient's health. Health is the type and quality of the patient. And nursing. Nursing is the nurse and how they apply their skills and nursing knowledge to care for their patients. Dorothy Johnson believed that the person is a behavioral system made up of these 4 meta-paradigms.
Johnson's theory has proven to be very useful in nursing practice and nursing education. There have been several articles and chapters written that support the usefulness of Johnson's model. It has been applied in a variety of studies in patient populations ranging from children to older adults. It has been applied in many settings, including inpatient, outpatient, and social settings. Johnson's theory has served as a curriculum guide for several nursing schools. Although it has been used in a variety of settings, it has been found to be more applicable to the care of long-term patients or patients with chronic conditions. There are limitations to its application in more acute situations. Although Dee in 1990 did a study that applied Johnson's theory and adapted it for the use of hospital situations. Next, we will discuss the testability of Johnson's theory. Johnson's model has been widely tested in nursing research, and over 20 research studies have used her theory model. The example that we will present to you was done by researchers Gunbari and Poi, and it focuses on the application of Johnson's theory to the care of a child in Iran with acute lymphoblastic leukemia. The purpose of this study was to investigate the clinical function and usefulness of Johnson's behavioral model in the case of a child with acute lymphoblastic leukemia in Iran. In this study, a care plan was developed based on Johnson's behavioral theory, with interventions based on the needs of each subsystem to treat and manage the child's symptoms. The care plan was then evaluated over a 10-day period. The subject in this study was an 11-year-old with a diagnosis of ALL. The care plan involved treating the symptoms including hyperthermia associated with an infection by managing temperatures, the danger of bleeding, infection prevention, maintaining her skin integrity, addressing her activity tolerance due to her disease, her nutrition, and her insufficiency in achievement, which involved her falling behind in school due to her illness. As a result, the patient showed improvement with the implementation of the care plan that addressed the needs of each of her subsystems and preventing the symptoms from her disease. She was fever-free, infection-free, had no signs of bleeding, had an improved appetite, and felt an improved sense of routine and improved confidence. Her needs were well provided for as a result of the implementation of the care plan that was based on Johnson's behavioral model. Johnson's model is quite simple and easy to understand. She's able to explain the entirety of her model in just a single short chapter within an edited book. There are very few concepts used in her theory, and the terms that she uses are easy to understand. The relationships that she presents are clearly explained. Johnson's theory has had a long-standing impact on nursing practice and nursing theory. Two other grand nursing theorists, Betty Newman and Sister Kalisa Roy, were students of Johnson, and they developed their models based on inspiration from Johnson. The Newman systems model and the Roy adaptation model are their respective theories that were inspired by Johnson's. A middle range theory based on Johnson's theory is the Jodarian behavioral systems model. It is comprised of 22 categories, and it is a data collection tool that assesses the major changes in one's behavioral system when they are sick and the positive or negative effects. The use of this tool has shown to improve the quality of nursing assessment as well as patient outcomes in patients with cancer, AIDS, and myocardial infarction, which are the patient populations that this tool has been studied under. Similar to Johnson's model, this behavioral model analyzes trends in human behavior when they are sick by categorizing, assessing, and implementing practice with the use of subsystems.